What are we discussing today?
We're going to publicly answer some of the questions related to COVID-19 asked by our family, our friends, and my patients, as well as a few Q&A from a presentation/conference that I just gave to UBS, an investment banking company.
Wow, no pickup lines or questions?
Why? Are you trying to say I'm pretty good at it now?
No, just got used to it, kind of expecting it.
Wait, so are you saying I'm not good at these pickup lines?
I didn't say that.
Okay, I'm sorry. Not today. No pickup lines today.
Why?
I have a plane to catch soon, so let's hurry up and finish this.
So why are we making answers to your family, friends, or your patient public?
Because COVID-19 infection rate and case numbers have been going up in Taiwan, and I think the answers to most of these questions, if not all, might be helpful for folks not only in Taiwan, but anywhere in the world that is still combating COVID-19.
All these questions were actually asked or brought to Pushy's attention over the past year and a half, as Pushy helped to take care of patients with COVID-19.
Correct. None is made up, even if some might seem like the case.
All right, let's go.
Howdy folks, welcome to our channel. I am Pushy.
I'm Mushy.
And we're the Pushy Mushy, yeah!
Serious.
So, B. serious is actually a gram-positive bacillus that has the potential to cause food poisoning.
Seriously.
We will do our best to combine facts with humor, but if we do make mistakes, please let us know and we will do our best to correct. Please like or dislike, hopefully not dislike, subscribe, comment, share, and press that bell icon.
Great. Is COVID-19 real? What are some common symptoms of COVID-19?
COVID-19 can cause a boatload of symptoms, and there is no need or point for anyone to commit these symptoms to memory. But the most common symptoms are fever, dry cough, and weakness. It is important to know that COVID-19 infections can also be asymptomatic or cause other symptoms.
What is the best way to prevent COVID-19 infection?
Vaccination, otherwise frequent hand washing, mask wearing, and social distancing.
If I have been infected with COVID-19, does that mean I have COVID-19 for life?
Very unlikely, because most folks who get COVID-19 will recover and eliminate the virus from their bodies.
If I am able to hold my breath more than 10 seconds without coughing, does that mean I'm COVID-19 free?
If you can hold your breath for more than 10 seconds, that means you can hold your breath for more than 10 seconds.
Why?
Nothing more and nothing less. The best way to diagnose someone with or without COVID-19 is through laboratory testing.
Is hand washing with soap the same as with an alcohol hand sanitizer?
No, whenever necessary, desired, and possible, we should use soap over hand sanitizer, because although alcohol-based hand sanitizers, when containing more than 60% of alcohol, can kill COVID-19, they're not able to kill all types of germs or remove all chemicals, but hand washing with soap will remove all types of germs from our hands.
If I use alcohol-containing sanitizer too often, am I helping COVID-19 to mutate or become more resistant?
Nope. Who, including germs, would resist alcohol?
Serious.
I'm sorry. No. Alcohol-based sanitizers do not seem to create antibiotic resistance, unlike other antibiotics or antiseptics.
What is the correct way of washing my hands using an alcohol-containing sanitizer?
Apply the sanitizer to your hands. Rub your hands together until they are dry. This whole process should last 20 to 30 seconds, so don't underdo it.
If I wear gloves, do I still need to wash my hands?
Absolutely. Wearing gloves does not replace washing hands. In fact, wearing gloves risks transferring germs from one place to another. In addition, we're also at risk of contaminating our hands when removing our gloves.
Does sun exposure help protecting us from COVID-19?
No.
Does taking a hot bath help protecting us from COVID-19?
No.
Does eating garlic help protect us from COVID-19?
No, but it might protect you from an annoying date.
Be serious.
I'm sorry. No.
Does drinking bleach protect us from COVID-19?
It might.
Why?
Because you might die from drinking bleach. And once you die, you might not be concerned about COVID-19 anymore.
Be serious.
I'm sorry. No, drinking bleach does not protect us from COVID-19.
Does fasting protect us from COVID-19?
No.
Does exercise protect us from COVID-19?
No, but we should all exercise regularly.
How long can people with COVID-19 infection be infectious for?
We have mentioned this in one of our previous episodes, but it is good to remind folks again. For folks with mild to moderate COVID-19 infections, they remain infectious no longer than 10 days after symptom onset. For folks with severe COVID-19 infections, they likely remain infectious no longer than 20 days after symptom onset.
Which medication used to treat COVID-19 are evidence-based?
Before answering this question, I want to say that ongoing research is happening, and this list can change. And one can certainly argue some or all of these medications are weak, depending on clinical situation. But for now, on a very general level, for hospitalized patients, not folks who do not require hospitalization, and only considering medications, 3 come to my mind: corticosteroids, remdesivir, and tocilizumab.
What about antibiotics?
No, antibiotics are for bacterial infections, not for viral infections, and COVID-19 is a virus.
Is it okay to call COVID-19 the China virus?
Why? No, it's not.
Is it okay to comment on someone's look resembling the COVID-19?
Why? I was speechless when I heard this question, but no, it's not. No. It is not okay to say or even think that someone's face looks like COVID-19.
So, Dr. Xu, could you tell us about COVID-19 impact on children and those with a vulnerable immune system?
For children, actually, COVID-19 hasn't been that bad. Research has suggested that children may actually have less severe illnesses from COVID-19 compared to adults. In fact, many children are asymptomatic. Now, that doesn't mean they don't have the illness. As we all know, I think most of us know that asymptomatic patients can still spread COVID-19. So it doesn't mean that children cannot spread COVID-19. It's just that as a general group, most of them are asymptomatic. Most of them don't require hospitalization. The most vulnerable populations that we know are older folks and folks with pre-existing medical conditions such as heart disease, diabetes, asthma, COPD, cancer, and many others.
Okay, specifically on the mental health part, will there be any concern of the COVID-19?
COVID-19 infections and the pandemic have also been associated with new or worsening of mental conditions such as depression and anxiety. The quarantine, the staying at home, and sometimes loss of jobs, those are all very stressful. A lot of people turn to alcohol. A lot of people turn to substances illegally. Growing findings have suggested that people do get more depressed. People do get more anxious during this pandemic time.
Final question. Is COVID-19 real? What? If you have questions, please comment below and we will try to answer your questions in a timely fashion. If you find our information useful, please feel free to share to your family and friends.
For the other Q&As presented at UBS, I will try to incorporate them in the future as appropriate. We're the Pushy Mushy. Thanks for watching.